Welcome back to NPO Showcase. My guest on this second segment of NPO Showcase is Shannon Wilson, who is the Executive Director of the Grand Rapids African American Health Institute. Welcome, Shannon.
Thank you. Great to be here.
Well, Shannon, what's the mission of the Health Institute?
Well, the Grand Rapids African American Health Institute was started in 2002, and we were really formed to help reduce health disparities that are seen primarily in African Americans, but also in other vulnerable populations here in Grand Rapids, and since have kind of expanded out to Kent County. In 2002-2003, we saw a report from the Institute of Medicine that really laid the foundation that disparities exist in health and healthcare based on race. And so from that work, we saw at the Urban League, which is how we were founded, we were born out of the Urban League, a need for a persistent focus on African Americans, and particularly a focus on reducing disparities and making sure that all persons living in Grand Rapids have an opportunity to experience great health and great healthcare and healthcare access. And so that's really why we were formed.
I was pleased to learn it came out of the Urban League. Somehow I had missed that in my years of watching what you do and did. If you were successful in carrying out this mission, what would be the result here in Kent County?
I think when we are successful.
Yes.
When we are successful in carrying out this mission, I think what Kent County residents will see is a community where all populations are healthy, where we don't see exuberant costs in a certain segment of the population because of the exaggerated health concerns in that population. I think we would see a population where consumers or the general public is educated about the disparities that exist within their population, but also about the health or prevention techniques that they can take to maintain their own health. We would see a population that is asking questions of their doctors and actively engaged in their healthcare system themselves, which is something that we don't necessarily see right now. I think we would see disparities reduced in our communities. We would see more people in our communities having access to good, solid medical care. We would see the physicians and the hospital systems ready to meet the needs of minorities when they walk through the door, because sometimes there are different challenges that minorities or other vulnerable populations face that the general public or the majority populations don't face. And so I think when we are successful, you'll see a totally different picture of health in this community. But most importantly, you'll see that African Americans aren't suffering disproportionately from health outcomes like they currently are.
You know, I was very interested in, I saw an interview last week of Michelle Obama in which she indicated that it was her pediatrician who questioned her about the eating habits of her daughters that made her aware, you know, back in the days when they were living in Chicago and were both working so many different directions, and how it was so much easier to buy a certain kind of food than, you know, and I thought, you know, God bless that pediatrician. So it's really important.
It is really, really important, and I will tell you, I also had a similar experience with Dr. Peterson, who is a local doctor here and works with the Children's Hospital over at Helen DeVos for Spectrum Health, and he was giving a lecture, and he indicated that we needed, as parents, and I have a 1-year-old, that you need to feed your children 6 home-cooked meals a week. And I remember thinking, oh my gosh, 6 home-cooked meals a week, that's a lot, you know. And even for working professionals who have the means to afford healthier foods, that's still a huge burden. So imagine if you don't have the means to afford fresh fruits or vegetables, or you don't know how to cook those fruits or vegetables, or have the time because you're working odd schedules to prepare those type of meals for your family. The differences in health outcomes, you can start to see how that happens just from something as simple as, you know, being able to put 6 home-cooked meals on a plate for your child every day.
My. You know, and that's an issue in today's world, where it probably wasn't an issue in the time of my parents, you know, where mom was home and you just knew
Yeah,
that
and
you're going to have a home-cooked meal.
A lot of things today are all about convenience.
Yes.
And so,
why is the focus solely African American? I'm grateful that it is, but why?
well, we again are focusing on African Americans because we know that African Americans are disproportionately impacted, and so we've seen throughout history, in the 1800s, W.E.B. Du Bois he documented health disparities in the African American population, and here 100 years later, we're still dealing with the same disparities in the African American population. We know that Martin Luther King, during his time on the earth, he spoke about disparities seen in infant mortality rates, and 5 years ago, Grand Rapids had, or Kent County had the highest infant mortality rate in the state for African Americans. And so when we're looking at these huge and vast disparities, we know that we needed to have a persistent focus here in Grand Rapids on improving the health of our African American population. Now, that's not to say that other populations don't need help. Right. And so we are exploring right now the possibility of working with our partners at the Hispanic Center and at Link to make sure that the Hispanic community is also covered in terms of having a persistent focus on the health needs of that community. But for purposes of the Institute, 10 years ago when we started this work, and now as we continue this work, we know that African Americans are definitely in need of having a persistent focus.
Right. And I suspect any gains you make will also be gains for all the other vulnerable populations.
Exactly, and so we're able to apply that same knowledge basis to the other populations as well.
Sure.
So.
10 years, how are you celebrating?
We actually just celebrated 10 years with a black tie gala. And so I often say, as a new mom, any child wants a fabulous birthday party, right?
Right.
And so we just had an absolutely fabulous birthday party. It was a lot of fun, very educational, kind of, I like to call it our rebirth to the community. We celebrated at the JW Marriott with a black tie gala. We brought in America's Healthy Chef. His name is Chef Marvin Woods. He actually kicked off Michelle Obama's Let's Move campaign, and he's all about making sure that families have mealtime together and that they are doing healthier options on their food. So again, he's probably the proponent of the 6 home-cooked meals a day, but just a great time of fellowship and celebrating our successes over the past 10 years, and it was just a fabulous event, so we're really excited to finally be 10.
Wonderful. And I know, Shannon, that you were the event organizer as well as the executive director, so
and
you've
so
got
I
a full
get to sleep
plate
now, right?
What are some of the major successes of these past 10 years?
Wow, we've had several successes over the past 10 years. To name a couple, we were responsible for Hypertension Sunday. We brought together 26 churches across Kent County and surrounding areas to really focus on hypertension one Sunday morning. We worked with all the clergy to make sure that they were giving health messages from the pulpit. We had nurses and health educators on hand to answer questions about hypertension. We also took blood pressures that day, and we had one lady who came in with a blood pressure well over 200 over, I think, 130 or something sky high. And we ended up sending her directly to the emergency room, and she credits us now with saving her life because of events such as this Hypertension Sunday, where we're able to let people know and really brand that your blood pressure needs to be 130 over 80 or lower. And so we really focus on the lower. But it's really important for the population that we work with that they have some understanding of the numbers that you're hearing.
Right.
And so a lot of times we would hear that people would go to the doctor, but when they tell you the numbers, you don't know what the goal is. Yeah. And so you don't know if you're high or you're low. And so that was a tremendous event for us, and one that was very, very successful. In addition to that, we've done glaucoma education series. We've done, we did something with diabetes, very similar, bringing nurses into the churches and nurses into the community to talk about diabetes, check blood sugars. We also have a FACE diabetes program that is co-sponsored between the Grand Rapids African American Health Institute and Eli Lilly. And what Eli Lilly does for us is they fly in a diabetes educator once a month.
Wow.
And she will go in, and it's an African American diabetes educator. She'll come in and she walks our diabetes patients that are interested in this program, and it's free of cost, of course. Everything we do is free of cost. But she'll walk them through a 3-part series that teaches them how to understand their diabetes better, ways to manage their diabetes, helpful tips with eating and exercise. And so it's really a great program. And when you finish, you get the Soul Food Cookbook for Diabetics. And so it's a really fun program that we get a lot of positive feedback on. We also work with seniors in the community, getting them education. We also do advocacy at the local, state, and national levels, making sure that our legislators are aware of the fact that we are working on behalf of their constituents to make strides in terms of health here in Grand Rapids and what their constituents want to see from them in terms of health legislation. And then finally, we also are engaged in research. And so we've had several successes with research, mainly our CHAT program, which follows more than 200 Grand Rapids residents that have hypertension, and we've been following them for a little over about 4 years now, monitoring them and making sure that their hypertension is under control. And so that's been a huge, wildly successful program.
That's wonderful. Shannon, how did you get involved in this work?
For God. I started off, I have my background is in epidemiology, and I've always very much so been interested in the intersection between health and race. And so I started off as the state of Michigan's first health disparities epidemiologist. Really, in that role, I got a chance to see the disparities that exist from a state level, and look at some opportunities that I really thought we could have some impactful change. I ended up on this side of the state working, I also work with the Alliance for Health, but working with the Alliance for Health and graahi because of my desire to really see us take it to the next level in terms of reducing disparities. And so working with the hospitals to make sure that they are being responsive to the needs of minorities, but also making sure that they're collecting the data so they know where these disparities exist, and that they're responsive to the community once they see where the disparities are. And so just, I think, a love for public health in and of itself, but also for making sure that vulnerable populations and populations of color are receiving the same care as other populations. And when that care, you know, that care isn't always the best possible care either. So making sure that everyone, the quality of care for everyone is great. So.
I asked that question because I thought if there's some young woman watching this program, I wanted you to be able to be a role model for them of what they can do.
I think anything is possible. And I was just sharing with someone else, I think my success thus far has been from having great mentors. And so I would always say, you know, find a great mentor or find someone with similar likes or dislikes or things that you're interested in, and really get engaged with that person, because it has opened up tremendous doors for me, and I'm able to work in a capacity that I love, and you find yourself so fortunate to wake up each morning and do something that you're really passionate about.
Oh, how wonderful. And we've only got very short time left, but how is all this supported?
We're supported by a variety of means, primarily supported right now through grants from the community, national, and state grants. And then we're also supported just by philanthropic gifts. And so this is a wonderful community in terms of giving, one of the most giving communities I've ever lived in. And so thank you, Grand Rapids, because this has been, the city of Grand Rapids and folks in Kent County are really helping keep this organization going. And I think it's just a testament to the work that we're doing and the need for this type of work in our community.
And I'm so grateful that Grand Valley State University saw fit to give you office space within that wonderful building.
They did.
Yes,
they did. That was part of an agreement with a three-way agreement between ourselves, the Grand Rapids Community Foundation, and the Grand Valley State University, seeing that there's a need for persistent focus on vulnerable populations, particularly populations of color, on the medical mile. And so we have great space and a great building, and thanks to our friends at Grand Valley State University for that.
And thank you, Shannon, for being here today. And thank you for watching NPO Showcase, a regular feature of GRTV. If your nonprofit wishes to be showcased, you can contact me, Barbara, 459-4788, extension 115. And in closing, I wish you a peace-filled week.